Welcome to PodcastRx, a production of Diamond Pharmacy Services. This is a show about pharmacy, but don't let the title fool you. While we definitely talk with pharmacists about medication topics, we also sit down with nurses, technicians, and other pros to discuss relevant issues in corrections health, long-term care, and so much more. Whether you're a pharmacist, a practitioner, or just find these things fascinating, this is a show for you. On this episode,
Audra Palmo took over as manager of Diamond's medical supply division in early 2020, transitioning out of a 20-year career in long-term care. She was on the job for a few months when the COVID-19 pandemic reached the U.S.
The first thing I did feel a huge sense of service for our community.
Suddenly, Audra found herself jumping through procurement hoops to secure crucial PPE.
I talked to someone in Texas trying to buy gloves. You have to buy millions of cases.
Trying to comfort panicked customers.
We had DONs that were just sobbing. We didn't have enough concentrators to get to them.
And she faced unprecedented infection control risk.
So if anybody was potentially exposed or maybe going to be exposed, or even if it was a question of exposed, they were code purple and they had a code purple kit.
Thankfully, her past long-term care experience was exactly what equipped her to face these new challenges in this new career setting. You'll hear all about Audra's story and more on this episode of PodcastRx. I'm Ashley Fritz. Welcome to PodcastRx. My name is Ashley Fritz, and I'm here today with Audra Palmo, who is our medical supply manager for Diamond. Audra, welcome to the show today.
Thank you, Ashley. I'm happy to be here.
We're happy to have you. So let's start off let everybody get to know you a little bit, because out of all of our guests, you're probably one of the newest ones to our team out of everybody else that we've spoken to. Tell us a little bit about your professional history, how you got into healthcare, and how'd you end up here at Diamond Medical Supply?
Well, I have always, ever since I can remember, always wanted to work in healthcare. I remember my mom is a nurse. I can remember always going with her to her jobs. And she used to take us to work with her because she thought it was good for us as kids to be able to go into the nursing home and see elderly patients. And she thought that would help us socially as we were growing up. And I always loved going with her. So I always knew that I wanted to do something in the healthcare field. So I went to college and I became a social worker. And my first job out of college was with children, but then I transitioned into healthcare social work in a nursing facility. And from there, I got my personal care license and was a personal care administrator and then became a nursing home administrator. I then was a nursing home administrator, got my license when I was about 26 for nursing home administrator. And I did that for a number of years. Before I worked for Diamond, I was this administrator at St. Andrews Village for about 7 years. And then I have been at Diamond for less than a year. So I've been here for about 8 months. And I worked with Luann, who's the CFO here, on some projects in the community with the Indiana Healthcare Consortium. And when this position opened, she called me, had Denise call me from Human Resources and asked me if I would be interested in applying for the position or interviewing for the position. And that's how I came to be at Diamond. And
That's
I'm
fantastic.
very happy to be here.
Yeah,
Yes.
We're happy to have you. That's great. I know you have a wealth of really great experience, but I want to talk a little further about something you mentioned. So right out of college, you got right into social work, which is a tough job. Mm-hmm. What was that like for your first career experience?
Totally different than I had expected. Mm-hmm. I always thought that as a social worker, you were just there to help people and talk to people and do things with people, as far as it was more touchy-feely type of things.
Sure.
And really in the nursing facilities, what you're doing is you're really just kind of a facilitator of services.
Okay.
So you're facilitating discharges. You're doing a lot of assessments. You're doing a lot of different types of things like that. So you're getting services set up for home visits. You're setting up transportation. You're setting up DME. You're setting up equipment.
Sure.
You're talking to someone that works at a place like Diamond. I worked a lot with someone like Ruth Ann Lee, who's been here for a number of years, and a lot of people in the nursing facilities work with Ruth Ann.
So regarding like insurances and things of that nature.
What covers, what doesn't cover, and you're getting them the things that they need. Scheduling home health for them for afterwards, or getting them Meals on Wheels or that type of thing. So you're not really you do talk to people who are maybe there longer term for, more like how they're doing and how they're settling in and those types of things, setting up medical assistance for them, talking to them about their insurance, their co-pays, their deductibles, that type of thing. But it's a very checklist type of a job, not as much of a touchy-feely emotional job. And it was so busy. And now, and more you're working with more conflict because families have really changed in the past, I don't want to say 21 years or so, because I've worked in the nursing home industry for over 20 years. I did 3 or 4 years as an executive director in hospice in the middle of that because I needed a little bit of a change. So I worked for a hospice agency as a director for several years, but families have really changed in that time frame. So it's been very interesting to see how society has really switched. So we're seeing more conflict with families, with their parents and with the doctors and with the staff. You're not as much as seen as a professional in the role anymore as they're telling you what to do rather than you expressing to them about how things work. But it was rewarding, but so challenging. Such a busy, a nursing facility job is the busiest job I've ever done.
Oh, I can imagine.
You're never finished.
There's so many moving pieces to ensure that somebody gets the best care in every possible avenue, whether it's, dietary activities, social work, helping them get the DME, which is, you're working for a durable medical equipment company, Diamond Medical Supply. And you are actually the first person we've had on our podcast that has represented our medical supply division. So we're excited about that. But because of that, we want to tell our listeners a little bit about what does Diamond Medical Supply do? What is the mission of Diamond Medical Supply?
Diamond Medical Supply, it's amazing what Diamond Medical Supply actually does. I really had no understanding the range of things, even when I was interviewing. And I was talking to Denise Grumley, who is the HR director for Diamond, and also for Luann Bowser, who is the CFO,
right?
Who they clearly have a very established and huge understanding of what Diamond Medical Supply does. I did not have a clue about the huge reach that Diamond Medical Supply has. And even when I talk to our vendors that deal with the medical supply side, they say that we are more of a dynamic medical supplier than anyone they ever have dealt with because of all that we do.
Right.
So we have an insurance end, but we also have a cash supply end.
Sure.
And we have a retail end. So we supply to all 48 states for cash supplies. So long-term care, we ship from here at our warehouse, but we also drop ship, which means that we can ship from suppliers and warehouses in several different locations across the country.
Right.
We also,
which has to be an advantage if people need supplies quickly.
It sure does, because we can order it from here and ship it from another location.
Right.
So just because we order it from Pennsylvania, we can ship it from someplace else within the country.
Right.
At the same price point that we would ship it from here. So
Excellent.
It's financially viable and logistically viable both. So we do it for prisons, correctional facilities, long-term care facilities, personal care, private individuals, and also like independent livings. So any type of forum we can do that for.
Right.
We ship all 48 states. We've shipped to Puerto Rico before.
Okay.
So it's a huge reach that we have.
Okay.
We can ship to Hawaii and to Alaska as well. It's just not as financially viable for them to do that. They're better off doing it.
That's not a problem exclusive to Diamond. I think that's something the lower 48 tend to get the ease of service that sometimes they can't get.
We would never say to someone, use the service if it doesn't make sense to them.
Of course.
Because ethically, it makes more sense for them to use something that's more viable for them. So we wouldn't recommend something. That's something that's really good about working for the Zillner family. They're very moral as it comes to their business, and I do really recognize them about that. Recognize that they're that type of a family to work for, and I really do like that about them. Right. So we do insurance, we do cash. The people that we service across the different types of entities, it's just amazing, and the different types of things that we do as far as insurance. It's everywhere from walkers to wheelchairs to incontinence supplies. It's just a range of different types of services.
And that's what I was going to say. Like the product line is tremendous. We're talking thousands of products.
Yes.
Everything as simple as like Band-Aids and gauze, like that stuff that you just have at home in your medicine cabinet, to something like hospital beds and alternating pressure pads and lift chairs. Like the product line is absolutely tremendous.
It is.
And I'm certain that every client base probably has their own set of needs.
Yeah, the correctionals order things that are significantly different than the long-term care.
Sure.
Than the nursing facilities do.
Sure.
And the types of products they have to have are different than what the long-term care do.
Well, because the general public wouldn't think like in a correctional facility, you can't send braces with metal in them and things of that nature. Because so many things, we've talked in previous podcasts, how so many things can be misused in the medication realm, and certainly anything in medical supply, they don't want anything that can be weaponized or anything of that nature. So you have to be very conscious of what you send.
You have to be really, really careful. And then there's also each different prison that we deal with. A lot of the pharmacists deal with, their medical directors, and the same thing with the nursing facilities. Each has medical directors that they want. Sometimes they want a certain type of, insulin needle, or they want a certain type of AccuCheck, or they want they have a formulary that they want to follow, or one type of facility wants a certain type of brief, but they have certain specific wants, just like medications that they have that we have to follow for them.
Yes.
And so it's a very kind of convoluted type of a system that we're trying to follow for different people.
Right.
So it's a very vast and expansive industry that we're in here.
Agreed.
So,
and I certainly don't want to neglect to mention, this isn't something that's nationwide for Diamond, but something that we do regionally. You have an excellent respiratory therapy team.
We have, I would say, the best respiratory therapy team from looking from the outside in. Because even whenever I worked outside of Diamond, they were, without question, the best that I've ever dealt with.
We've heard that feedback so much from local folks who've dealt with them. Just they're kind, compassionate, and so knowledgeable.
Yeah. Our senior respiratory therapist, Judy Schmeiko, is very well known in the area just because she's been here for over 20 years or 20 years easily, and just very well known for her knowledge. And we are one of the things that I'm really looking forward to is expanding products here and doing different products to grow, and respiratory is one of them.
Excellent.
So I know we're going to talk about COVID, and that respiratory team was one of the biggest groups of people that were on board to really be supportive of that pandemic, because it was obviously a respiratory disease.
Yeah. So let's talk.
We're going to take a little break now to tell you a little more about the Diamond Drug Information Center. On a personal level, we all appreciate when our pharmacist gives us a thorough consultation for a new or complex medication. They dispense not only the drug, but important information about dosing and possible interactions. This kind of medication counseling is easy to understand on a personal level, but what about on an institutional level? Where do healthcare providers, especially those delivering care to large populations with diverse needs, go when they need medication counseling? Enter the Diamond Drug Information Center. The pharmacists of the Drug Info Center dispense in-depth clinical consultation for all of Diamond's customers, from correctional facilities to nursing homes. This team of PharmDs specializes in pharmacotherapy and disease state management. And if you have questions about dosing, drug-drug interactions, non-formulary medication requests, therapeutic alternatives, or you just need general clinical advice, they're a call away. They also take proactive steps to educate healthcare professionals. They issue regular clinical updates, and they develop webinars and presentations about specific drug topics. You can reach the Diamond Drug Information Center at 800-882-6337, extension 1834, or email them druginfo@diamondpharmacy.com. And now back to PodcastRx.
So let's talk about COVID. So you were with Diamond a few months, just kind of getting your feet wet, trying to, taking, it's a big job coming in as a new manager and a big undertaking. So of course you're dealing with all that. And then virtually we stop because COVID-19 hits. So tell me a little bit about what was that like in the early days of the pandemic? How did you think it would affect the mission of Diamond Medical Supply? And when this kind of first came to light, because I think as it did come to light, a lot of us weren't sure kind of what was coming. What kind of strategy did you and your team start to come up with?
Well, in the early days of me being here, I was working on a strategic plan, because I'm a strategic planner in general. Because when you work in the long-term care industry, you have to have a strategic plan, period. So I was working on a strategic plan to grow med supply, but that got just ambushed.
Of course.
So thank you, COVID-19.
Yeah.
But the first thing I felt was tremendous guilt because I left long-term care.
Right.
And I knew in my heart that long-term care was going to be neglected because everybody was looking at this as, what are we going to do for the hospitals? And I felt that personal care and long-term care were going to be really where it was going to be hitting because...
And we've definitely seen that.
Well, and they don't have the isolation capabilities that a hospital does, especially personal care homes.
Right.
And then, of course, nursing facilities.
Of course.
And if somebody was going to get the disease, they were going to try to isolate them in those locations because that's their home and that's where they were going to be. And I've worked with the Department of Health for over 21 years. And I knew I just felt in my heart that I had left behind a lot of great staff members that I had led for a lot of times. So the first thing I felt was terrible guilt and how was I going to help them?
Sure.
But I was at Diamond and this was my new team. And there are great, great people who work at Med Supply here. Diamond is very fortunate to have the team that they have here at Med Supply. Here at 639 and lovingly down at 135 is what we call our retail store down on Oakland Avenue. So the first thing I did feel a huge sense of service for our community.
Right.
And for our safety of our staff.
Of course.
Our drivers, we have drivers that are actually employed by Diamond, and we have drivers that are MTS drivers, which are contracted courier service.
Mm-hmm.
So our drivers that are Diamond employees, I was immediately concerned about them because they are our frontline staff that truly do go out into the field and physically touch patients every day.
Yeah, of course.
They're delivering equipment to the hospital. They're in the nursing facilities. They're in personal care. They're in patients' houses.
Yes.
And the first thing that, Judy Tomiko, who's our senior respiratory therapist, also does our infection control. Initially, that was our first thought was, okay, these are the people we really have to be thinking about because they're still going to have to go out and they're still going to have to carry on what they're doing every day because we can't put a moratorium on they need a bed, they need a wheelchair, they need oxygen, they need these things because COVID's going on because they still have to be able to do this. And how do we prepare them? Because we have to be able to respond to the pandemic of what's going on and keep them safe.
Yes.
That was our first thought. My next thought was, okay, we have to get the equipment that we have to people, but we have to maintain what we need for Diamond too, because not only do we get equipment and supply the community, the states that we have,
of course,
we also supply Diamond Pharmacy and a lot of the other entities, because Diamond is a pretty huge entity.
Of course.
They have pharmacies more than just here. We have pharmacies in Pennsylvania and we have a pharmacy in Ohio. And we do a lot of the supply for PPE for them.
Right.
So we have to maintain supplies for them as well, knowing that we're not going to get more.
Correct. I mean, and on a regular basis, we're sending a lot of personal protective equipment, PPE, out the door just for general use. I mean, anybody who works in healthcare knows how many gloves, masks, how much hand sanitizer, how much of that you go through under normal circumstances. And COVID-19 truly changed the game.
Correct. So I had to work with Debbie Yakubowski, who's our nurse practitioner, on what do we maintain here for our staff for Diamond Pharmacy, period. We have nurses in the IV that do IVs. We have pharmacists that work under a hood that are preparing IVs. I mean, there are so many different parts of what we do here that they need PPE.
Of course they do.
To get medications out the door to our patients, to our clients that need that. So what do we maintain in-house? What do we have to send out? So we had to maintain some of what we had to be able to continue to operate. So we had to keep that on site. So we really had to do a good inventory of what do we have here and what can we really send out? What can we get in? And we were really, really kind of locked into keeping some of the things here so we could maintain our operations.
Well, of course, because it came down to a lot of resource management. And I know we had Debbie Yakubowski, who you just mentioned on the podcast a few episodes ago, and it was something she spoke to, because as important as it is to get those things in the hands of our customers, we also needed to, at all costs, keep COVID-19 out of Diamond, because we have patients all over the country that are relying on the medication and supplies that Diamond provides. And so it was definitely a balancing act.
Yeah. Yeah. So we did a lot of that. We worked with, we were on the COVID calls, worked with Debbie on a lot of resource allocation like that. We trained our drivers on how, even the simplest things, like I don't think, and a lot of it is my nursing home administrator background that I think really benefited me to be able to say, these guys don't even know how to appropriately put on PPE in the correct manner.
Sure.
And take it off in the correct manner, because there's a sequence to putting it on and there's a sequencing to taking it off.
Absolutely.
that you don't get yourself infected. So even training them how to don it and doff it to make sure that you're not infecting yourself. So that's one of the first things that Judy and I did, was to train them on how to do that type of thing. We also set up a precaution key where if you have someone that anytime that we're delivering something, we have certain questions or picking something up. Every person, if we're ordering something and they're going to be delivering it, we ask them questions. Have you been in and out of the country? You know, the annoying questions that we're so tired of hearing.
The questions we've all had 100 times.
We were asking them.
Of course.
Probably almost before anybody else was, because we were not going to let them go into that environment. And if there was that type of a situation, we coded them as code purple, and we made them a code purple kit. So if anybody was potentially exposed or maybe going to be exposed, or even if it was a question of exposed, they were code purple and they had a code purple kit. And they had to take the code purple kit with them, and that included all the appropriate PPE, and their equipment was bagged in a certain way. Because we also had the question of what happens if their equipment that's coming back could possibly be contaminated.
Of course.
And we were following CDC guidelines for it to be setting. And even at some point we said to the family, set it outside. If you're okay with it sitting on your porch and covering it, because if it's set for so many hours based upon CDC, it was okay.
Right.
You know what I mean?
Right.
So we even had some of our equipment sitting on someone's porch for so many days, and we would just go pick it up then and still follow certain guidelines. And most people were very accommodating. Or we would explain to someone how to use something, unless it was a bed or something. We explained to them how to use it, and we'd put it on their porch and they'd take it inside. We didn't get a lot of instances where Code Purple was enacted, because fortunately Indiana County wasn't a hot spot.
We have been very fortunate.
Yes.
Indiana County has remained relatively unscathed through the pandemic.
But we did have a couple instances. And if we got a Code Purple and it was something that somebody didn't absolutely have to have, the rule was they had to convince me why they felt that they needed it. The guys had, like the person doing the intake, they had to convince me, because one of the guys came in and said, are we really going to take these to these places? If it's something that's not really necessary, I go, you have to convince me why you're going to take it.
Right.
Not, I'm going to convince you why you're going to take it. Because there is no reason. There's some things that can wait.
Yeah. And I think we saw that strategy across the board at a lot of healthcare providers.
Yeah.
If it was something at a hospital, if you had a procedure coming up that was not life-saving, if it was something that could wait a little bit, they're going to wait, because they're trying to
Absolutely.
keep as many people away from a potentially bad situation.
Right. But we maintained full operation the whole time. None of our staff worked from home except for one person who had some underlying health conditions, and her job fully could have been done at home. Our retail store stayed open the entire time.
Absolutely.
None of them wanted to shut down. They all wanted to work, and it stayed open fully.
And I know there's been guidelines down there, like nothing that people are unfamiliar with now. You have to wear a mask, social distance, and that nature, but definitely have been open for business, because it's an essential supply. I mean, if you're caring for someone who needs briefs, or incontinence supplies, or if you have an injury, you need to be able to get to a medical supplier to get what you need. Sometimes you can't order online and wait for something. You need it right away.
Exactly. And things like colostomy supplies and catheters, those aren't things that you can wait for.
Right.
Absolutely not. But it's been, and everybody's been very calm. I feel like the whole entire, here at least, and we have more than one division that works out of this building, everyone's been very calm and rational about it, and they've done a very good job as far as maintaining confidence, I think, in what Diamond's been doing to prevent the disease from getting here or spreading here and that type of thing. So I feel like it's been overall a very good reaction.
And I think a testament to that is that Diamond has done excellent. And we have over 1,000 employees, and our impact of COVID-19 has been very, very, very small. So thankfully, we've been fortunate. The strategy you guys have been doing, it's been working. It's a testament to that. So it's excellent work from the COVID-19 task force.
Yeah, I feel like it's been a very pragmatic approach. I'm a pragmatic person in general, and I feel like overall our team has been very pragmatic in the approach in general, and I think that that's been very helpful.
Excellent.
Thanks for listening to PodcastRx from Diamond Pharmacy Services. If you're a fan of the show and have any topics you'd like to hear us discuss, or if you have any thoughts on a particular episode you'd like to share, please email us at podcastrx@diamondpharmacy.com. And while you're at it, please rate and review our show wherever you get your podcasts. Your feedback helps us make the best show possible for you. And as always, we appreciate your feedback and support. Now back to the show.
While we're talking about COVID-19, I want to bring up our respiratory team and some of the challenges that they faced, because obviously COVID-19 being a respiratory illness, what kind of challenges did you guys face straight away into the pandemic?
One of the first things that we did with our respiratory team is we did stop respiratory visits, which I do want to mention that Diamond is one of the only respiratory companies that still does respiratory visits after you get
Home
respiratory
visits.
equipment.
Right,
Yeah.
right.
So I think that's pretty
I
amazing.
think it is too.
That was hard for the respiratory therapist to do,
I'm
because they do
sure.
like to go out and do the visits.
And they have such a rapport with their customers.
They sure do. And I think that lends a lot. And we do a ton of respiratory. Respiratory is one of our biggest businesses here at Med Supply, probably our biggest. So I think one of the most difficult things here was, since it is a respiratory illness, and a lot of our customers did get multiple patients that got the illness, because once it got into a nursing home or personal care home, like we had talked about earlier, they don't have the capability really, especially in the personal care homes, to really isolate. They don't have the negative pressure rooms. They couldn't get the PPE they needed. We really tried to focus on those facilities.
Sure.
So one of our strategic plans was, if we got a facility that had it, we really tried to focus what we had on them. So we had DONs call us crying, or personal care home administrators call us sobbing because they needed this equipment. So when the pandemic first came out, Judy Tomiko, a respiratory therapist, senior respiratory therapist, and I met with Greg Campbell, who is our senior oxygen room technician, and we scoured the area to get as many concentrators as we can.
Yes.
5 liters, 10 liters, whatever we could get our hands on. We bought them new, we bought them used. We bought as many as we could.
Of course.
And because we knew we were going to need them for our patients.
And that's something they can't do without.
Absolutely not. So Medicare dropped their guidelines for even having to have diagnosis for some of it to be covered, because they knew that people were just going to need it, or having the testing to have it. Actually, the testing to have it covered, because there are certain testing you have to have. So if you had a diagnosis of COVID, you didn't have to have the testing. The diagnosis was good enough to have it covered. So we had DONs that were just sobbing. We didn't have enough concentrators to get to them.
Sure.
So we had tanks. So we could send them tanks, or if they had tanks, because you can use tanks. There's certain tricks that you can use as a respiratory therapist to be able to use tanks instead of concentrators, or concentrators instead of tanks. Judy knows all the tricks.
She's a master at that. And
Yes.
I remember when this first started to come about and you were getting those calls, that she approached us and wanted to do a quick video tutorial on some tricks you can do with the equipment you have, how you can make it work for your needs. And some of the tips, I had no idea.
Right. So you were very gracious, and we were able to get Judy and Deb, who's one of our other long-term respiratory therapists, to get that video pulled together, put those tips together, get it in a YouTube video, and send that to that DON specifically. And some of the other ones that I personally know and Judy knows that we're having some difficulties, get them links to that video to show them how to maintain oxygen for their patients on some different tools and tricks so that they could maintain oxygen levels on their patients if they don't have concentrators, using some of the tanks, because we can get tanks for days. Yeah. Tanks are easier to get than concentrators. Because you can refill them, and
of course.
Right. And
it was a situation where you guys had to think outside the box and help give some solutions to customers, because it was just something unprecedented in any of our lifetimes. We haven't seen anything like this before.
Exactly. And we sent it to some of our pharmacists to share with their DONs too, because Med Supply doesn't service every place that Diamond Pharmacy
of course
services. Right. So we sent it to some of our pharmacists to share with their DONs. And that director of nursing was so appreciative. And I don't know if I shared that with you, but she said it helped her so much. And it calmed her and relaxed her. And she utilized the tips. And they had a rough go at that facility. Yeah. It was one of the worst ones in the state with this. And I know that I shared it with some of my friends, some of my colleagues, that they were struggling as well with some of their facilities out east. Because those things, you saw all the things about the ventilators. So they weren't making concentrators. They were making ventilators.
Of course.
Because the same places like Respironics that make ventilators, they also make concentrators. So they were concentrating on one thing or the other at that time.
Like so many other things. We've seen supply chain issues, so many supply chain issues through this pandemic. We've seen it with ventilators. We've seen it with PPE. We're seeing it now with something like laptops so kids can do school at home. We've seen so many supply chain issues through the pandemic, and respiratory equipment was certainly not immune to that.
Right.
But I have to ask, what was it like for you? Because you mentioned at the beginning how you left the long-term care, personal care, skilled industry, and you had a little bit of guilt going into this pandemic. What was that like for you when you actually start getting calls of people literally in tears trying to deal with this?
That's a tough question. I felt like I talked to my friends that I had left behind or didn't work with anymore probably every day.
Yeah.
And I felt like I was kind of their support system for a while on the outside of the facilities, kind of in a different way.
Yeah.
And some of them were living in a different world because they actually had large amounts of COVID in their buildings. And I guess I just kind of felt like I could be a different type of support for them, because I think if I was living it with them every day, I couldn't have been a different person for them to talk to, because I probably couldn't have been as empathetic, because I wouldn't have been able to manage probably the emotions they were going. So I probably couldn't have been an emotional support for them. But I think with being on this side of it, I felt like with the DON that we dealt with the respiratory situation, I said to her, I'm a nurse. I was a nursing home administrator until 2 months ago. And I think that she related to me a little bit differently on the phone, and she responded a little bit differently to me, because when you're in the nursing home world, you just understand each other differently, because you actually live through events kind of together, and you go through a lot of different types of emotions together as a group or as a team. So I feel like I can support people differently from the side of it. And I felt like that's kind of what I had to do. We put people on allocation pretty quickly here, and it was frustrating for some people, but I feel like we put allocations in pretty quickly on things, but at least then we could support more people.
Right.
And I think that if we did that, because I felt like as an administrator, I'd rather have something than nothing.
Of course.
And I also really work here hard to teach urgency, because urgency is very important to our customers.
Yeah, you've been on that side of it.
Yes.
You know.
And so urgency and getting them what they need is something that I'm really trying to instill in this at Diamond with Med Supply, because patients need things quickly.
Quickly, of course.
And in this pandemic, with the supply chain issues, we still don't have things as quickly as we need them. Right. I don't know when that's going to end.
Right.
We can get some things too, but the things that we can get are so expensive. And I don't know when that's going to end either.
So has it, compared to how it was at the start of the pandemic when you could never find a bottle of hand sanitizer, even like on a shelf, has it gotten some better?
Yes. A lot of things have gotten better. We have hand sanitizer. Mm-hmm. It's just a lot more expensive than it used to be.
It used to be, of course.
We're not price gouging anyone. Actually, Mark Zoner is a blessing, I have to say. This Diamond's lucky to have him. Indiana's lucky to have him. The whole entire industry of the pharmacy industry and the med supply industry is lucky to have him. He's worked really hard to get us the things that we have.
I know he worked very hard to make sure we
had
inventory of masks.
I don't know if he slept for weeks at a time over this stuff.
To make sure that employees were supplied with N95 masks, which every employee was supplied with one. Mm-hmm. I know he really worked hard to make sure that could happen. And
he did. And I heard the anguish in his voice over how hard he was working. I truly did. And he was a brand new boss to me. Mm-hmm. But I saw how hard he worked and what he got us. And some of it seemed like it disappeared. Like, I don't know some of his masks, I don't know if they were confiscated or what happened to some of them. Like, that's the thing with this procurement issue at this point in time. Some of the things that he was supposed to get, like some of the 3M masks, the NIOSH certified ones, they just are gone.
Where'd they go? Yeah.
So where did they go? Mm-hmm. Some things were being confiscated by the different ports that come in, the governments, that type of thing. Some people he knows had their masks taken and taken by the government, probably to be given away to the healthcare entities. I don't know for sure.
It's hard to say. And I think it's a lot of things people wouldn't understand about the supply chain. As much as you do hate to say it, and this is on a normal basis, most of these things come from overseas.
Right.
It's not like there's a mask shop down the road that we're all getting our masks from. Unfortunately, that's not how it works.
And they always have come from overseas.
They always have. This isn't new. This isn't a new situation.
And they're keeping them to protect their own countries.
Of course.
And so when we're fighting to get them out, we're paying for, he's buying like a ship worth or a container's worth or whatever that is. Right. And it's an exorbitant cost. And so we have to charge for what he has to buy is like millions of them, or somebody's buying millions of them, or we have to buy. I talked to someone in Texas trying to buy gloves. You have to buy millions of cases. Yeah. So what we're buying, we're upcharging. We're not price gouging. We're upcharging like we always have. And we're upcharging actually less than we usually would.
Just to get a reasonable price for the end user.
Yes.
Yeah.
And so, but what we're upcharging and we're getting, some of the prices are that people are actually asking us to pay. It's unspeakable.
Yeah.
So some of it we can't even buy because we couldn't even charge our customers what they're even asking us to buy. So we're buying smaller quantities a lot of times and still allocating.
Of course.
Because at least we can get people some of the things that they need without bankrupting them.
No, I understand.
Very frustrating. It's a very frustrating. It's a very frustrating balance.
You're trying to procure them in a fair amount, and in some ways, I don't want to say we're getting price gouged, but it's a much more challenging process to get PPE in than it usually is. And gosh, we've even seen it. I know, like vendors like Amazon were running into where vendors were trying to sell it for exorbitant amounts. So we've just seen those prices spike and go through the roof, and to try to make it affordable to the customer. It's been a process, and I know a lot of time, a lot of thought, a lot of work has gone into that. And I think overall the team has done a really good job. Yeah. And I will say that as we speak now, if you go into our retail store here in Indiana, PA, you will find hand sanitizer, you will find masks. Those things are available.
And there are gloves there.
And there are gloves there. So we're trying to make those things the best we can available at reasonable prices to those who need them.
Right. And the charges are just what they have to be for what we are paying for them.
Right. And, I know it's tough to look on the other side of this because I know we've talked about within our department that, back in March, we thought, by the time we get to September, this will be a distant memory. And here we are. We're still in the thick of it. We're seeing spikes with kids going back to school, kids coming back to college. We are a college town, so we have a university here. Mm-hmm. We've seen a spike, albeit a relatively small one. We've seen a spike. So unfortunately, we're still in the midst of this pandemic. So it's hard to see what things will be like on the other side. But hopefully, as we get into 2021, those supply chains will loosen and kind of get back to where they should be. So Audra, one more thing I want to ask you before we wrap up. We really appreciate you being here today. You have such an interesting background. I too have worked in with elder care, with like long-term care and skilled and like those kinds of programs. So I'm curious, like with your background, because of COVID-19, what do you see being some permanent changes in those kinds of industries? Because I don't think a lot of things are going to go back to normal. And what do you see in that industry? How do you see some things changing?
I do definitively feel that the regulatory components of long-term care are going to remain more stringent. I feel that the infection control regulations are going to remain high. I feel that the visitation is going to be more strict, and that there's always going to be some type of a mask or infection control component to visiting your relatives or your friends or your loved ones in the nursing facilities. And I think that the masks are here to stay in one way or another. I feel that there's going to be a lot more rules and regulations around that. So I do think that the residents in the nursing facilities are going to be much more protected as far as that goes. So I think that that's going to be one of the biggest, and I think that in the hospitals too, personal care homes as well. And I hate to say it's for their own protection. I hate to say that, but I also think some of it is because maybe, and I can say this because I'm not in the nursing facilities anymore, so nobody can come and like come get me because I'm saying it. I think there wasn't enough forethought into what they were going to experience during this. Sure. Of course, the nursing homes and the personal care homes were going to get hit the hardest. Of course, they were going to get the most cases. Of course, that was going to happen. Gowns are still one of our hardest. We can't still get gowns. Yeah. That's probably our hardest ones to still get. Mm-hmm. So, of course, the nursing facilities are going to be the places that can't get them. So, of course, they're going to be the hardest ones hit. So that's going to be a place where the Department of Health is going to react the most and blame the most and have the most sanctions toward. Yeah. So I really think that that's where the most liability is going to fall upon. So I think that going to visit that sector is where you're going to see patients and visitors have the most restrictions upon them as far as infection control. And I think that's what we're going to see going forward.
Yeah, it's going to really be interesting to see as we get into 2021, hopefully start to put this behind us. I know unprecedented times, but we really do appreciate the work that you and your team have done to try to keep the customers served and safe. And a great job keeping your own team safe, too. So thank you again for being on PodcastRx. Again, I'm here with Audra Palmo, the manager of Diamond Medical Supply. Thank you, and we'll look forward to having you on the show again.
Thank you.
Thanks.
This podcast features conversations with healthcare professionals. Their statements and opinions discussed herein are for informational purposes only. This podcast should not be considered professional medical advice and should not be used as a substitute for the advice of an appropriately qualified and licensed healthcare professional. Therefore, listeners must not rely on the statements made herein.
PodcastRx is a production of Diamond Pharmacy Services, the nation's largest correctional pharmacy provider. Catch new episodes on your favorite major podcast platform. And wherever you listen, please be sure to leave us a rating or a review. If you have a topic or a guest you'd like us to feature, feel free to shoot us an email at podcastrx@diamondpharmacy.com.
Music in this episode by Wolfgang Worley. Sound expressed by Getty Images. Additional music by the 126ers and Silent Partner.